Hello everyone, welcome back to the channel. In this video, we will see about the anatomy of adductor canal. Adductor canal is also known as Hunter's canal or subsartorial canal, as it is located beneath the sartorius muscle. That is why it is named as subsartorial canal. The adductor canal, it is a narrow conical tunnel located in the thigh. It is 15 cm long, extending from apex of femoral triangle to the adductor hiatus of the adductor magnus. This serves as a passage for structures which are moving from the anterior aspect of the thigh to the posterior leg. So this is giving passage to the femoral vessels from femoral triangle to the popliteal fossa. It is a trough-shaped structure which is intermuscular tunnel extending from the apex of femoral triangle to the fifth osteoaponeurotic opening in the adductor magnus. It is lying in the middle one-third of the medial aspect of the thigh. So here we can see the schematic diagram to understand how the adductor canal is located. It is extending from the apex of femoral triangle up to the adductor hiatus. Then from here the femoral vessels reach to the popliteal fossa, and now the femoral vessels are termed as popliteal vessels. So this is the adductor hiatus, which is the fifth osteoaponeurotic opening in the adductor magnus. Now the boundaries of the adductor canal. Adductor canal is bounded anterolaterally by the vastus medialis muscle. So in the diagram we can see this is the vastus medialis muscle. Then in the roof or in the anteromedial aspect of the adductor canal, we have the sartorius muscle and the subsartorial fascia, which is lying beneath the sartorius muscle. In between the sartorius and the subsartorial fascia, there is a plexus of nerve, which is known as subsartorial plexus. This subsartorial plexus of nerves, it is formed by the medial cutaneous nerve of the thigh, saphenous nerve, and anterior division of the obturator nerve. This plexus supplies the overlying fascia lata and the skin. Then the posteromedial boundary of the adductor canal is formed by the adductor longus in the superior aspect and adductor magnus in the inferior aspect. So in the nutshell, the boundaries are: anteriorly it is bounded by the subsartorial fascia with overlying sartorius, laterally by the vastus medialis, posteromedially adductor longus superiorly, and adductor magnus inferiorly. Now the apex. Apex of the adductor canal lies at the medial lip of linea aspera, where vastus medialis and adductor muscles meet. So at this point we have the apex of adductor canal. Now the contents of adductor canal. Adductor canal contains the femoral artery, vein, saphenous nerve, nerve to vastus medialis, the obturator nerve. These are the contents of the adductor canal. Now the femoral artery in the adductor canal extends from apex of femoral triangle to the fifth opening of the adductor magnus, and in this canal it provides descending genicular branch before leaving the adductor canal. So here we can see the descending genicular branch for the knee joint provided by the femoral artery in the adductor canal. Then we have the femoral vein, which lies behind the artery in the upper part of the canal and posterolateral to the artery in the lower part of the canal. So here we can see the relation of femoral artery and the vein. Then we have nerve to vastus medialis, which is one of the content of the adductor canal. This is the thickest muscular branch from the femoral nerve, and it is located lateral to the femoral artery. And it enters the vastus medialis in the upper part of the canal. Then we have saphenous nerve, which is the longest cutaneous nerve of the body. It crosses the femoral artery anteriorly from lateral to medial side. It leaves the canal by piercing the fibrous roof. Just before leaving the canal, it produces infrapatellar branch which pierces the sartorius and joins the patellar plexus and supplies the prepatellar skin. So here we can see the saphenous nerve is providing the infrapatellar branch at the knee joint, which is forming the plexus, that is the prepatellar plexus of nerves, for supplying the skin over the patella. Then this saphenous nerve continues downwards on the medial aspect of the leg and supplies the skin of the medial aspect of the leg and the medial aspect of the foot up to the great toe. Then we have two divisions of the obturator nerve, that is anterior and the posterior division. In this we can see the origin of the obturator nerve. Then this obturator nerve traverses through the pelvis and comes out through the pelvis through obturator foramen and enters into the medial compartment of the thigh. In the thigh, it divides into two divisions, anterior and the posterior division. The anterior division gives branches to the subsartorial plexus and the posterior division supplies to the knee joint. Then we have profunda femoris vessels in the adductor canal. The profunda femoris artery is the largest branch of the femoral artery. It is providing muscular branches and perforating branches in the adductor canal. Then we come to the clinical anatomy. In this we can see the adductor canal compression syndrome. In this we have entrapment of neurovascular bundle within the adductor canal. It is because of the hypertrophy of the nearby structure, that is the vastus medialis. Most commonly it affects the young males. In this, when there is compression of artery, it is causing the pain on walking, and due to compression of the nerve, it causes pain or numbness due to entrapment of saphenous nerve. Then we have adductor canal block. The local anesthetic is administered in the adductor canal to block the saphenous nerve in isolation or together with the nerve to vastus medialis. This is used to provide sensory anesthesia for the surgical procedures involving distal part of the thigh, femur, knee and lower part of the leg on medial side. Sartorius and femoral artery are used as anatomical landmark to locate the saphenous nerve. Then we have ligation of the femoral artery. The femoral artery is exposed and ligated in the adductor canal during surgery for aneurysm of the popliteal artery. Aneurysm means the localized ballooning of the artery. So for treating the aneurysm of the popliteal artery, we have to ligate the femoral artery in the adductor canal. This surgical procedure was first done by Dr. John Hunter. That's why adductor canal is known as Hunter's canal. So this is all about the anatomy of the adductor canal. Thanks for watching.